A pleasant day to each and everyone. I am Jonathan M. Tong, and I am here with my fellow groupmates to present our topic in NCM 1010, Nursing Informatics, entitled TeleHealth. So for the introduction, let us start by defining what is telehealth. So according to the Medline Plus year 2020, telehealth is defined as the use of a communications technologies used to provide healthcare in a distance, delivery, and facilitations of health-related and health services. So if we will going to look back the difference of how technologies are used before and comparing up in this present time, we can say that there are a lot of changes that brings us into the advanced world of what we have now. And these technologies has a huge impact and play a great role in this 21st century of living. And if we are going to observe our surrounding, especially in the field of education and in medical, technologies can be seen everywhere and which is applicable of what we are doing now. So it is said telehealth as the use of a communication technologies to provide healthcare in a distance. So meaning to say, with these communication technologies, we are able to transfer among information into other people or into other machine. And the examples of these are of what we are using now, like our gadgets, our phones, tablets, laptops, and especially with the access to the internet. And telehealth now are used in hospitals and clinics, and that has something to do with the relevance of serving health. And the thing that we can do here first will be the video conferencing. It is a two-way interaction to support another. And store and forward, it is a picture or a text that can be recorded and sent. Next will be the remote patient monitoring. It is one of the best functions of a telehealth in providing care. And lastly will be the mobile health. These are the use of the gadgets of like phones and tablets to send care information into one institution to another. Next. So telehealth is a broader term that covers a range of remote healthcare services and often refers to non-clinical services. So it is called a broader term, meaning to say it covers a large and a wide scope of areas in healthcare services and non-healthcare services. So of what I have mentioned earlier, this includes in like a remote patient monitoring, mobile health, and store and forward. While in non-clinical services, this includes like health trainings, administrative trainings, patient education, continuing medical education, and health administration. It is the extension of a telemedicine that both involves telecommunication technologies in health services. So telemedicine is an additional part of a telehealth or a subset under of telehealth, and later on we will talk about and define of what is telemedicine. Next, telemedicine is a specific type of a telehealth that refers to the use of a technologies to deliver medical care to a patient. So in another term, telemedicine can be defined as a practice of hub, which is the site of where the distance practitioner delivers service through the use of telecommunication system. And one of the best example of this will be a phone call of a patient wherein he need to seek the advice of a doctor for a non-emergency medical problems, wherein for example hindi niya na kailangan pumunta or makipagkita sa doktor. And the difference between telehealth and telemedicine ay telehealth ay mas malaki sa telemedicine. While nasabi natin kanina na ang telemedicine ay nakapaloob sa telehealth, kung ating susuruin ito ay parang sila ay isa lamang. Sila ay parehong ginagamit sa pagbibigay ng serbisyo sa kalusugan by the use of our technologies. For the purposes of telehealth, we have here the next reporter.
I am Danica P. Santos. I'm from the purpose of telehealth. So first, to reduce the burden of travel. When patients use telehealth, they don't need to travel from home to hospital or clinic to get a consultation. It saves their money, time, and effort. So second, to make the patient or client comfortable because they are in their home while doing the consultation. And then third, from better and easier to assess healthcare. So, since hindi na kailangan mag-travel ni patient papuntang hospital para makapagpa-consult, ang kailangan na lang niya is mobile phone or laptop and internet connection. So, mas mapapadali kay patient ang maka-assess sa medical care. So, last and most important, telehealth maximize the risk of acquiring infection diseases such as COVID-19. So, since hindi na nga kailangan lumabas ni patient and hindi na din niya kailangan makipag-interact personally sa ibang tao. So, into the next reporter.
Now, for the background of telehealth, for decades, telehealth has been leaving its impact on the medical industry, and it took years of technological investment and federal legislation to make this new achievement achievable. And for its evolution, around when medical care was still provided by in-care visitations, and as time passes, telehealth changes and develop into a system of healthcare delivery, and telehealth service ensures that the economy has an affordable and efficient system. And for the next reporter,
I am Angelo Arcerdillo, and for the timeline, evolution of telehealth. In 1840, electric telegraph was invented. In 1876, telephone was invented. In 1928, Aerial Medical Service was the first organization that has limited geographical access to healthcare with the help of telecommunication. In 1950s, Nebraska Psychiatric Institute used closed-circuit television to monitor patients. In 1964, two-way video link was established. In 1972, space technology applied to rural Papago Advanced Healthcare delivered remote healthcare to Papago Indian Reservation in Arizona. In 1974, the National Aeronautics and Space Administration or NASA studied how to use telemedicine. In 1989, the first international telemedicine project was launched. In 2000, video chats like Skype was introduced for virtual video chat. In 2015, healthcare goes mobile. And for the next reporter,
Good day everyone, my name is Daniel Luis Senior, and now we'll be discussing the body part. So now we'll be talking about the description of telehealth, its evidences, and the arguments and discussion regarding this topic. So first, let's talk about its description. So what is telehealth? So telehealth and telemedicine are used interchangeably with one another, but to describe telehealth, it is the delivery of health services such as medical care, health information systems, patient education, as well as self-guided care with the use of technologies such as the internet, telecommunication services, and digital technologies. Now, the integration of telehealth into the nursing practice breeds telehealth nursing, and a telehealth nurse's role is basically the same with the role of a nurse in a hospital setting. That is because they both provide care for the clients as well as they provide patient education and patient counseling when necessary. So with the recent developments and technological advancements, telehealth now offers more than just booking clients digital appointments. Now they offer real-time healthcare assistance and support for the client from a distance. So now let's move on to the evidences of telehealth in the nursing practice. So we have here some articles concluding that telehealth provides positive outcomes for both the healthcare providers and the patients. So now let's move on to the evidences of telehealth in the nursing practice. So we have here some articles concluding that telehealth provides positive outcomes for both the healthcare providers and the patients. So first, let's talk about the patients. So according to a peer-reviewed article by the Center for Care Innovations in 2021, telehealth is very beneficial for the patients as it improves their quality of life, their mental health status, and reduces their hospital admissions by mitigating their health risks that they may experience. Also, with the COVID-19 pandemic, telehealth is very useful as it helps to deal with the client's health problems at the comfort of their own home, so they don't have to go to the hospital for a quick checkup. So next, let's talk about its benefits for the healthcare providers. So according to the same article, they said that telehealth is commonly used for communication between the patients and the healthcare providers. And also it is useful for conducting counseling sessions and remotely monitoring chronic illnesses. So in counseling sessions, they can either use video conferencing apps such as Skype, Zoom, or Google Meet to conduct their sessions, and remotely monitoring chronic illnesses is easier with the use of gadgets such as the Apple Watch or with the use of mobile apps that can monitor the vital signs of the patients independently. Next, according to an article by St. Catherine University in 2021, they said that telehealth nursing teaches nurses additional skills and techniques. This is because telehealth nursing is relatively new within the medical field, and because of this, nurses need to have information literacy and technological literacy. Also, they have to learn how to address communication gaps between the telehealth visits, as well as they need to learn how to effectively communicate with the clients through the screen or through the telehealth visits, because this is very much different from the face-to-face communication with the clients at a hospital setting. Lastly, according to a research study by Bashir and Basila in 2018, they asked 13 nurses about the efficiency of telehealth within their work, and this answer basically sums up the response of all the participants, and it says here that telehealth provides independence and a sense of security for both the patients and the caregivers due to daily monitoring. Now on to the next reporter.
Hello, my name is Evan Angelo Sangin, and I will be reporting the arguments of telehealth. So first, here we have the pros of telehealth. Modern times like today are all about technological advancement and the use of new technologies, especially in the healthcare world, where new technologies helps our nurses, doctors, and specialists to make their job faster, easier, while still providing a high quality care for our patient. So for the first pros of telehealth is the virtual care, where in-person visits nowadays can be done through video online conferences. So unlike dati na pumupunta pa tayo sa mga hospital for our checkups, pwede na siya ngayon gawin through online. And mas convenient to para sa mga gumagamit or sa mga patient kasi they do not have to go to the hospital, especially para dun sa mga nandun na sa bahay or sa mga busy sa trabaho at walang time para pumunta sa hospital. The next is the specialist and physician referral. It is another one of the pros of telehealth, where it specializes in mabilisang referral para sa mga pasyente. Example, hindi naman laging available ang mga attending physician natin pagka nagpapa-check up. So, with the help of telehealth, ginagawa niyang mas mabilis ang proseso na ito. Humahanap siya agad ng mga available na specialist or physician para i-check up ka. So, through online din ito, pero mas mabilis yung proseso. And, of course, tutulungan ka rin ng telehealth para hanapin yung specific na physician para sa specific na kalagayan ng patient or kung ano man yung gusto niyang ipa-check up. The next is the on-the-spot appointment. So, unlike dati, na pumupunta pa tayo sa ospital para magpa-appointment, then pipila tayo ng mahaba, maghihintay tayo ng matagal para lang ma-check up. So, with the help of telehealth, on-the-spot appointment, nagagawa niyang on-the-spot appointment. Wala nang lines to wait. Agad-agad ka nang i-check up ng mga available na physician na gumagamit ng telehealth. The next is patient-centered. So of course, sa hospital naman, lahat naman is patient-centered, nakafocus sa pasyente ang ating mga medical staffs. So of course, sa telehealth, ganun din, na-provide pa rin nito ang same care na napoprovide ng mga hospital through online din. Then next, here we have the cons of telehealth. So syempre, hindi naman lahat perfecto. Telehealth is still growing and is a striving tool. It is not yet complete and still has flaws and imperfections. So first of the cons of telehealth is the technical problems. So since it is a program run by computers or other gadgets, hindi na iiwasan magkaroon ng technical problems. So dito nababase kung gaano kagaling mag-ayos yung IT staff or kung gaano ka-well-trained yung IT staff. So, pagka well-trained yung IT staff, hindi siya nagiging cons. Pero, pagka nagka-problema sa mga IT staff and yung mga other staff like mga physician na gumagamit din ng telehealth, dito na nagkakaroon ng technical problems or yung hindi convenient or hindi efficient way of providing service through telehealth. Then next, here we have the reduced care continuity. So reduced care continuity, like I said before, di ba nire-refer tayo sa ibang physicians or sa specialists through the use of telehealth. Ang downside nito is pagka na-refer na tayo, minsan hindi na i-send yung record agad-agad dun sa ni-refer na physician. So, ang nangyayari, nagkukulang yung history ng checkups ng patient and walang data yung pinag-referan na physician. So, hindi ma-check up ng maayos ang ating patient and hindi makikita yung history or kung ano yung care na kailangan gawin para doon sa patient. Then next is limited access. So, since telehealth, ginagamit, it is run by programs and ginagamitan to ng mga gadgets, computers, phones, and etc. So, hindi naman lahat merong access sa phone, sa internet. So, yun yung downside ng telehealth. Hindi lahat nakakagamit. Papaano naman yung mga walang cellphone and yung mga walang access sa internet? Naiiwan sila sa traditional way of paghihingi or pag-seek ng medical service or attention. Then, lastly is the loss and reimbursement. So, syempre, since medical services ang pinoprovide ng telehealth, kailangan lagi nagki-keep up yung loss, lagi nagki-keep up yung provider nito sa mga panibagong medical laws and sa mga reimbursement policies. Pagka ito ay nakalimutan at hindi na-keep up to date, automatic terminated ang program nung telehealth provider na yun. So that is it for the arguments of telehealth, where the pros and cons of telehealth is shown and discussed. Now on to the next report.
The future directions of telehealth is composed of 5 subtopics: the future of telehealth, the increasing demand for telehealth care, the role of telehealth during the COVID-19 pandemic, telehealth interventions in improving chronic diseases, and telehealth in the Philippines. Let's first tackle the future of telehealth. Telehealth provides patients with favorable outcomes. This is because it helps the healthcare staff members to have an access to a network of healthcare specialists to provide top-notch treatment to their patients and the community. Improved care with new tools and software is expected from telehealth, since nowadays our world is becoming more modern and more technological advancements are being created. Telehealth market is expanding globally as it has an expected compound annual growth rate of 14.9% from 2019 to 2026. This means that the investments on the telehealth market is expected to grow at this rate. Increasing demand for telehealth care. Telehealth is continuing to gain popularity worldwide since it is getting more attention from different countries due to the various services that it can offer. The demand grows along with the number of patients with chronic diseases because, of course, as the amount of sick people increases, then the demand for telehealth will also increase because patients are monitored more thoroughly even if they are in another location, especially when the patient's disease is chronic because they are the ones who need care or service for a longer time. According to COVID-19 Healthcare Coalition, 75% of surveyed patients expressed a strong interest in using telehealth. So there are already patients who have experienced telehealth, and majority of them are favorable. And the increase in the demand of telehealth is because of such elements as care continuity, efficiency, and convenience. Care can be continued even if the patient is at home. It is also efficient because it requires less effort from the patient and its family. And there's also cost reduction since there's no need to admit the patient in the hospital just to wait for the result or just to talk to the doctor, and health insurance isn't required. And of course, convenient since traveling is also not required and there's no need to leave home or take an absence from work. The role of telehealth during the COVID-19 pandemic and its potential in the future. Telehealth use has increased 38 times since the COVID-19 pandemic. At the start of this pandemic, we experienced lockdown and we weren't allowed to go outside their homes. At the same time, there are still people that get sick or some people that already had such diseases and needs medical assistance. And telehealth's usage increased because of its ability to deliver healthcare digitally and without having to go outside the house when it's not necessary. During the COVID-19 pandemic, telehealth is widely used in such nations as Brazil, India, Philippines, and Nigeria. Remote delivery to reduce virus spread during the COVID-19 pandemic was also achieved because during this pandemic, we do our best in order to limit our contact with other people to keep ourselves safe. And telehealth allows us to achieve this because it's conducted digitally. Therefore, it lessens risk and exposure to the virus, presents increased accessibility, especially for patients who live far away, and the disabled patients when they don't have that much energy or when they find it a challenge to travel. Advances in nanotechnology, sensor technology, and mobile communications will impact on how healthcare is envisioned in the future, and these are all contributing in the development of telehealth. On to the next topic.
On to the telehealth interventions in improving chronic disease. According to the Community Preventive Services Task Force, for those who don't know what CPSTF is, they provide evidence-based findings and recommendations about community preventive services, programs, and other interventions aimed at improving population health. Going back to what I'm saying earlier, they suggest a number of telehealth activities for reducing chronic disease risk factors in patients and improving chronic disease conditions. These conditions include obesity, or the abnormal or excessive fat accumulation, high blood pressure or the hypertension, diabetes or a disease that affects the body's ability to use or produce insulin, HIV infection or being infected with a virus that attacks the body's immune system, end-stage renal illness or the permanent stage of chronic kidney disease, and lastly is the recently diagnosed cardiovascular disease or the disease that affects the heart or blood vessels. Now let's move on to the systematic reviews used to make telehealth recommendations by Community Preventive Services Task Force or the CPSTF. In this part, we will talk about the CPSTF review, the chronic disease condition or risk factor, the delivery method, and its main takeaway. For our first CPSTF review, we have cardiovascular disease, mobile health interventions for treatment adherence among newly diagnosed patients. This is for the patients with recently diagnosed cardiovascular disease. The delivery method is mHealth or mobile health. They provide text messages that provide information or encouragement for treatment adherence, or reminders for medications, appointments, or treatment goals. They also provide web-based content that can be viewed on mobile devices, applications with goal-setting functions, reminder functions, or both, interactivity or patients entering their personal data and tailored information, and lastly is communication with the healthcare provider by mobile phone. For its main takeaway, it shows improvements in medication adherence, outpatient follow-up, and adherence to self-management goals. It also shows that mHealth interventions may be most useful and effective during the initial management period of patients with newly diagnosis. For our next review, we have the cardiovascular disease interactive digital interventions for blood pressure self-management. This is for the patients with high blood pressure. For the delivery method, they use mHealth and remote patient monitoring or RPM. They use interactive contents or patients entering their personal data or making choices through computer or smart devices. The patients also receive tailored education and feedback without direct input from a health professional. And lastly is it has self-measured blood pressure or the SMBP monitoring, counseling, or follow-up with the health professional. For its main takeaway, it shows improvement in blood pressure measurements, and it also shows that interactive digital interventions can be a central component of SMBP or the self-measured blood pressure monitoring or provide additional support for patients. For our third review, we have the Health Information Technology text messaging interventions for medication adherence among patients with chronic disease. So this is for the patients with cardiovascular disease, diabetes, HIV infection, or asthma. For the delivery method, we have the mHealth. They provide text messages that provide medication dosage times and weekly adherence reminders. And the messages may be also personalized or delivered as a part of two-way communication with a healthcare provider. For its main takeaway, it shows improvement in medication adherence. For our last CPSTF review, we have the Health Information Technology Comprehensive Telehealth Interventions to Improve Diet Among Patients with Chronic Disease. So this is for the patients with cardiovascular disease, diabetes, end-stage renal disease, or obesity. For the delivery method, they use video conferencing, RPM, and mHealth. There are telehealth interventions delivered by phone, videos, applications, websites, or email, and it may be combined with in-person interactions and most commonly delivered by phone. For its main takeaway, it shows improvement in dietary outcomes such as in diet quality and healthy intake, and it also shows benefits for blood pressure control. Let's move on to the telehealth here in the Philippines. Telehealth has become more popular in the Philippines as a result of broader access to information and communication technology over time. Due to the pandemic, teleconsultations are now possible via COVID-19 hotlines, websites, and mobile applications developed by numerous organizations and companies. Here are some of the telehealth in the Philippines. For the first one, we have the Medify. In order to relieve the overburdened Philippine healthcare system, Medify began operating in 2015. Medify guarantees you to link with a doctor online wherever you are as one of the few telehealth providers that is available 24/7. You can either look for a certain specialist through the company's official app or connect with an online doctor at random. Second one, we have the Consulta MD. It is a 24-hour helpline that offers phone-based medical care. Health plans include access to partner benefits, e-medical certificates, e-laboratory requests, and e-prescriptions in addition to unlimited phone consultations. The third one we have is the Health Now. By offering 24/7 online medical consultations via video conferencing, Health Now differentiates itself from other telehealth businesses in the Philippines. The Consult Now and the Consult Later online medical consultation services are provided by Health Now. Next, we have the Aid. It's established its online medical consultation option on its app, even though it is best recognized as a platform for home healthcare. Aid currently offers one of the industry's most complete online telehealth offerings. Among its various services are laboratory testing, physical therapy, immunizations, and nursing care. Next, we have the DocPH. The Philippine Medical Association, or the PMA, created its own online medical consultation portal in an effort to aid in remote management of COVID-19. For the next one, we have the DOH COVID-19 hotlines. To address COVID-19, the Department of Health also offers telehealth hotlines. Everyone with a phone can now contact the DOH directly for COVID-19 concerns, thanks to a cooperation with PLDT and the Department of Interior and Local Government. Next, we have the Generica Libreng Teleconsulta. Generica Drug Store has made its free medical consultation service available over the phone to assist Filipinos during this health crisis. Every Generica location in the Philippines or in the country offers Libreng Teleconsulta. And then the last one we have is the Bayanihan e-Consulta. It was established by the Vice President's Office and provides free teleconsultation services for NCR outpatient cases. It serves Filipinos without access to healthcare providers or telecommunications infrastructures. And that's it. That's the end of our presentation.